Hi, well this video may not be my most popular video, but it may actually induce some people to get a little mad. That's okay, because I'm going to give you 7 ways that will tell you if the Syntonics program that you're doing is a real Syntonics program, or if it's just kind of a fake Syntonics program. So get ready, because today my gloves are coming off, and I'm going to give you some details about whether or not your program is the real deal. Now, before I go into doing that, let me tell you how you can connect with us. I'm Dr. Julie Steinauer, and my clinic is Vision for Life and Success. If you're local to us, give us a call at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can do one of 2 things. You can take a quiz. You can also actually look around the website and see some success stories. Or if you're ready for that next step and you're serious about correcting your visual problem, then it's time for you to schedule a consultation. So click the button and schedule a consult with me. Now let's talk about the 7 ways in which you can kind of determine if your Syntonics program that you're doing with another doctor, not with us, is a real deal or not. Number 1, if you only use 2 filters the entire course of treatment, let me guess, if I had my crystal ball, I'd put it in front of me and go, I bet you're using red and green, because that's the only 2 filters that almost everybody else in the world tells me they've used in their Syntonics program. And usually it's the only 2 filters they've ever used. But looky here. I don't even have half of them. There are somewhere around 50 to 60, maybe even more. I haven't really technically counted, but I have a bare minimum of about 38 filters in my clinic that I use.
What?
There are a lot of stinking filters. Why is your doctor only having you use 2? Might indicate it's not a real Syntonics protocol. The second reason, or second way that you can tell in which your protocol that you're following might not really be a full Syntonics program, is that you wear those 2 said filters for the entire course of the treatment program for 10 minutes each. 10 minutes is kind of like hooking up an electrode to the brain and zapping it for 10 minutes constantly, again and again and again and again and again. If someone has had a neurological insult prior to starting Syntonics, like a traumatic brain injury, their brain's on hyperdrive already. It's evidenced by the fact that most people don't like lights, they don't like sound, and they don't like to be in real hustle, bustly, busy places. So if their neurological system is kind of on edge, putting on Syntonics glasses and going 10 minutes and 10 minutes is way too much stimulation for that brain. And it's going to cause a lot of negative symptoms. Now, what we do instead is that we typically recommend only 2 minutes and 5 minutes. And even from that, I may titrate down and say, you didn't tolerate that really well. Let's go down to a minute. Let's go down to 30 seconds. Or if we start at 5, let's go down to 3 or 2 or 1 minute. And it's based on your neurological system, on how your brain is responding to the filters. Blaring them for 10 minutes each, really not appropriate in almost any case. And I know that might make a couple people a little bit fussy, sorry to say, but it's just the truth. Now, because your patients are good patients, or you as the patient are a good patient, you're typically going to kind of keep following your doctor's advice until it gets so bad you just can't tolerate it anymore. That's one reason, though, again, why your program might not be a real true Syntonics protocol program. Number 3, they don't even tell you what to do. So if your doctor doesn't even tell you and give you a sheet and explain all of the things that you should be doing while you're doing Syntonics, how to move your eyes, I forgot to take your blood pressure, how to move your eyes, what light to look at, how far away to look, what type of bulb, that you should stay visually and mentally active, cognitively active while you're doing the Syntonics. If you don't have something like this, or like what our office does in addition to that, we also provide a video that's a step-by-step tutorial telling you exactly what to do with your Syntonics program. And of course, if you have questions or concerns after watching that, you can still call us or you can email us. But if you don't have that, if your doctor's not giving you all of these little specific things, telling you what to do and making sure that you're doing it exactly the right way, how do you even know if you're doing it the right way? Well, the thing is you don't. And that's why I get these questions on YouTube all the time from other doctors' offices, patients contacting us and saying, what should I do about this? My doctor never told me how to do this. How should I do that? Almost every day. Number 5. So this is the 5th way that you can tell that your Syntonics program might not really actually be a real protocol program, is that if you get started and no one even follows up with you. You might not even be able to contact the office, which I can't even tell you how many times that happens. I hear this probably at least once a week, that they started on a Syntonics protocol, the doctor never followed up, or the office never followed up, and they could never even contact the office to find out what to do next. That's like a nightmare. Imagine going to your doctor and being given a prescription medication for some sort of serious problem that you have, and then you can't even follow up. Maybe you got a rash from taking that medication, or maybe you started throwing up and you're like, oh my gosh, what do I do next? And you try to contact the doctors, you can't even get a hold of them. What would you think on that? It's like, hello, did they disappear? Where'd they go? Are they gone? Are they off the planet? Okay, if that's happened to you, you might not be in a real kind of serious program. Number 6, they don't even explain to you what the filters are doing and how it's affecting your neurological system, that it is altering your brainwave patterns and changing your brain electrically, and how it's outputting information throughout your entire body, and in how it's helping your visual system to process better. Now, don't misread this, because many people will want to be educated to the point of getting their doctoral degree. If I had a little certificate I could show you now. Okay, that's not the point. The point of you being educated enough to know what the filter is doing is to say that you know this filter is for brain healing. This filter is for helping with the alignment of your eyes because your eyes tend to cross. This filter is to get your 2 halves of your brain working better together. This filter is to slow down your nystagmus. We're not here to give you a full education so that you can get your doctoral degree at the end of our Syntonics program, but we are here to make sure that you know a little bit about what it's doing, because it provides clarity, it provides a hand of realism to things, and I think it also makes it feel like it's a little bit more real and realism and a little bit more authentic. Number 7, and the last way that you can tell if your Syntonics program is really truly like the real deal, or if it's just kind of a fake and not so real program. Remember, just 2 filters, no real correspondence on how to do anything. Number 7 would be that if you actually develop worsening of your symptoms. So this is really common. In fact, I hear about this at least about once every week or 2 weeks, where someone reaches out to me to say that with this other program that they did, they developed an eye turn, or their symptoms got worse, they got double vision all the time that they didn't have before. Now, this is really tricky. If you're having a worsening of symptoms, then we need to be able to alter things. We need to look at it and go, what's going wrong? Let's be like a detective and find out what's happening in this case so we can alter it. Again, maybe we need to decrease the time. Maybe we need to change the filters. Maybe you need to do the filters with your eyes closed and a light directed at your face rather than staring right at a light. Maybe you can't move your eyes. Maybe your eyes have to stay stationary because it incites your problem to be worse. We have to be able to communicate fluidly back and forth with one another in detail about what you're experiencing, and then alter things. Because even though we have a very specific system for our patients that we follow, and each person's has some components that are similar, but many components that are totally different and unique to them. Even though we've got that kind of a system, and it's unique to us, it's not like you can go down to XYZ doctor and they're going to have the same system. This is the system that I developed. And so it's something that's very unique to our practice that we're using, whereby we look at healing the brain, working through balancing the system, balancing alignment of the eyes, and several other things. So you've got to be able to have that very close relationship with your doctor or with their office to know, like, hey, there's been some development here of some sort of a negative symptom. Some patients will develop things like tics, facial tics, okay, where they will suddenly twitch in their face or their eye will begin twitching. Maybe something else develops like light sensitivity. It can happen. This is directly stimulating the nervous system. So it's electrically stimulating the brain to have a nervous system output and response throughout your, not only for your visual system, but it does occur throughout your whole body. This can cause some negative things to pop up if you're not really careful and you're not following a protocol that's very specific to you. Even if you are. So even with our protocol, we will sometimes have a patient who crops up with something negative. The idea is that I should be right there to answer the question and put them on the right path, or to redirect it or change it somehow. Because that is what's truly going to tell you the difference between a fake program, because they're usually just going to go like, stop the filters, just don't do anything right now. Oh, that didn't work out, I'm not sure what to do next. Where I'm going to say, again, maybe I need to change the amount of time, maybe you need to close your eyes, maybe we need to do it a different time of day, maybe you need to do it after you've had some lunch. There could be a million things in there that I could list that I might need to adapt or alter. So if you're not getting that kind of thing where they are adapting and getting you through the condition that popped up for you all of a sudden, then that's a real problem. You should not be getting into a Syntonics system that's making you feel worse, unless it's a little bit of time, like a day or two, that you get past something and then it's on to the next. But it shouldn't be months and months of it getting worse and worse and worse. That's totally wrong. Syntonics is actually meant to be a very kind of calming, quiet, easy, slow way into the neurological system to alter a lot of things about the way that your brain is processing your visual system. It's not meant to be a hard slap in the face. It's not meant to be a boot or a kick to the butt in any way. It's meant to be a gentle process. So if it's doing something that's really inflammatory, where like, oh my gosh, this is so bad, I can't even take it anymore, then that's a problem. Your doctor needs to know how to alter that. If they don't, you probably should be seeing me instead. I have a very proven and effective method. It's something that I developed a couple of years ago. Over the course of years, I kind of sat down and tweaked it a few years back. And I really got to looking at, how does the brain heal itself? How does the neurological system work when it needs rebalancing? What happens in the brain that's affecting this kind of binocular or two-eyed vision system? And once we've maybe done some brain healing, what do we do to correct all of this? And then how do we actually make this stuff last so it doesn't just go away the minute you walk out the door and you're done with your program, and you can maintain this down the road? So our system's tried and true. I have patients who come to me literally from all over the world, unfortunately from other doctors who've caused them to have a lot of problems, or that they just didn't feel like it was successful at all, that it seemed like it was completely a shot in the dark and they had no idea what the Syntonics was actually supposed to be doing. They had no idea it was really altering their neurological system. They just thought they were looking through some stupid red and green filters. Again, if that's you, I kind of clean up the mess that I get from all over the world. And if you want to contact us, our phone number is 618-288-1489. You can go to our website at visionforlifeworks.com. Tool around, look at all the information. But your next step is really to schedule a consultation and see how I can help you. If you like this video, hit the like button. If you haven't done so, subscribe. And if you feel like this could be beneficial, you know someone maybe who's gone through this, maybe a neighbor, pass this video on. Thank you.